Hi everyone, my name is Victory Bryant, and today I will be doing my presentation on hormonal contraceptives. So there's many different types of contraceptives, but my presentation will focus on hormonal contraceptives in particular. And hormonal contraceptives are also known as birth control, which is what people most commonly know it as. And there are six different types of hormonal contraceptives, such as the implant, injection, which is normally referred to as the shot. There's also combined oral contraceptive, progestin only pills, the patch, and hormonal vaginal contraception rings. The implant is a single thin rod that's inserted under the skin of a woman's upper arm. The rod contains a progestin that is released into the body over the course of 3 years. The injection method involves women getting shots of the hormone progestin in their buttocks or arm every 3 months from their doctor. The combined oral contraceptive, which is known as the pill, contains estrogen and progestin and is prescribed by a doctor. This pill is taken at the same time each day. And although, unlike the combined oral contraceptive pill, the progestin only pill, which is also sometimes referred to as the mini pill, also has it only has one hormone in it, which is progestin, instead of as the standard pill has estrogen and progestin. And this is also prescribed by a doctor as well, and it's taken at the same time each day. So the patch method of birth control consists of a skin patch that is worn on the lower abdomen, buttocks, or upper arm, but not the breast, importantly. And this method is also prescribed by a doctor, and it releases estrogen and progestin hormones into the bloodstream. A new patch is put on once a week for 3 weeks, and then during the fourth week, no patch is worn so that the woman can have her menstrual period. The hormonal vaginal contraceptive ring releases progestin and estrogen hormones. The ring is placed inside the vagina by the wearer and is worn for 3 weeks, then taken out for a week so the woman can have her period. Then a new ring is put in a week after the removal. If there's any questions about any of that, please feel free to ask me any questions. The hormones that are included in the hormonal method of contraception work to inhibit the body's natural hormones to prevent pregnancy. And this type of contraception typically stops the body from ovulating. It also changes the cervical mucus to make it difficult for the sperm to go through the cervix and find an egg. Hormonal contraceptives are actually the leading method of birth control in the United States. And here I also have detailed the effectiveness of birth control, which typically ranges between 99 to 91%. And the intrauterine device, which is also known as the IUD, is the most effective method of birth control, and the pill is known to be one of the least effective methods, just due to the high likelihood of imperfect use. And this is because women have to remember to take the pill daily and at the same time. But there are apps to actually help remind women to do this as well. And in 2015 through 2017, 64.9% of the 72.2 million women who are between the ages of 15 through 49 years of age using contraceptive in the U.S. All right, and here I have detailed a little bit more of an explanation regarding the effectiveness here of the different methods of birth control. But as I said earlier, I will be emphasizing the hormonal contraceptives in particular, which you can find in Tier 2 here on this slide, where you can see that about 4 to 7 pregnancies happen per 100 women in 1 year who are using these methods of birth control, which are actually the hormonal types. And then the IUD is also a type of hormonal contraceptive as well, and the implant, which is in Tier 1, where you see that less than 1 pregnancy per 100 women per year tends to happen. And on the least effective end of the types of contraceptives are where more than 13 pregnancies per 100 women in 1 year tend to happen, and that consists of these types of like the male condom, withdrawal method, and these other types of birth control here, which do not include the hormonal contraceptives. So here's a chart provided courtesy of the United Nations. And this chart details the estimated number of women of reproductive age, which is between 15 through 49 years of age, that are using the various types of contraceptive methods worldwide based on data from 2019. And here you can see again, like I said, that the IUD has 159 million users, which is about 17% of women all over the US. And then, so that's for hormonal contraceptives. But as you can see, female sterilization has about 219 million users, which is about 24%. So that's actually the most used form of contraceptive. But like I said, that's not a type of hormonal contraceptive. But so I'm focusing on the hormonal contraceptive. So the IUD would be the most popular relating to my projects and relating to my presentation. And then the pill falls second with having 151 million users and 16% of women worldwide in reproductive age. So here is a table showing the trends of contraceptive prevalence by by method, according to among women of reproductive age, which is again between the ages of 15 through 49 years of age. And this is organized by region from 1994 and 2019. So here we can actually see that the intrauterine device is most used here from 1994 to 2019 among people who are living in Eastern and Southeast Asia. And then the pill here in Sub-Saharan Africa, it looks like it had a slight decline here in the percentage, but it stayed relatively very stagnant. And one of the most used forms we can see here in Sub-Saharan Africa is the use of injectable contraceptives, where we see a huge spike actually between 1994 and 2019, and in the United States, in Europe and Northern America, we can see here that the pill is actually the most used type of hormonal contraceptive that had an increase between 1994 and 2019. So the prevalence of contraceptive use among these women has continuously evolved slowly over the years, both globally and regionally. And this data shows that the use of the pill has remained at a consistently low percentage at less than 5% prevalence in Sub-Saharan Africa from 1994 to 2019, whereas in more developed countries, such as Europe and Northern America, the prevalence has increased during this time frame and is higher than 15%. All right, and here you can see that this information shows that the most women who use contraceptives in sub-Saharan Africa, which is down here at the bottom here, you can see that it shows that most women in sub-Saharan Africa use injectable contraceptive methods based on the dark green bar, and you can see that that they also have the lowest use of contraceptives overall at less than 30% compared to the rest of these regions here. And Eastern and Southeast Asia have the highest prevalence over here at about 60% of contraceptive use when comparing to the other regions here. And then Europe and Northern America followed a pretty close second to to Eastern and Southeastern Asia. And in North America, we can see here again that the most used type of contraceptive, that the most prevalent type of contraceptive here is the pill. And yeah. All right, and as far as protective factors, um, hormonal contraceptives can protect against ovarian cancer, uterine cancer, ectopic pregnancy, ovarian cyst, um, benign breast disease, iron deficiency anemia, and less severe menstrual cramps. So these are the benefits that that women can have with the use of hormonal contraceptives. And also, it also helps protect against acne, unwanted hair growth, pelvic pain due to endometriosis, and also pelvic inflammatory disease. And so the risk factors that are associated with the use of hormonal contraceptives include nausea, sore breasts, decreased sexual desire, and spotting and the spotting that happens between periods. And the use of hormonal contraceptives can also cause vaginal yeast infections, which is also known as thrush, and spotting between periods. The risk of developing venous thrombolism can also be higher in women who are 40 years of age and older due to the use of these contraceptives. Depression has also been found to, so this is actually based on a study that was done in Denmark. And it shows that the relative risk of, and this details the relative risk of the first use of an antidepressant, and it's compared with birth control users and non-birth control users. And the mean age that was included in this study was 24 years of age. So as you can see here, depression has been associated with the use of hormonal contraceptives, and the patch has been found to have the highest relative risk when compared to the vaginal ring, intrauterine system, progestin-only pills, and combined oral contraceptives. The patch has a relative risk of 2.0 with a 95% confidence interval between 1.76 through 2.18. And combined oral contraceptives have a relative risk of 1.23 with a 95% confidence interval as well. And this range between 1.22 through 1.25. And you can also see here that hypertension was also found to have a 13% increased risk for every 13 for every 5-year increment of oral contraceptive use. So basically, what that means is that for every 5 years that a woman was using oral contraceptives, it increased her risk of hypertension by 13% for each 5-year increment. And so here are some methodological issues that are related to the use of hormonal contraceptives. So there are some concerns about the methodological issues and concerns that are related to the use of hormonal contraceptives. And so one of the issues that I want to highlight is related to the use of intrauterine devices, the removal of the devices specifically. So, according to a study by Kaplan, about 7 out of every 10 women complained of pain complaints, and intermittent heavy vaginal bleeding and severe abdominal pain were all found to be associated with the removal of these intrauterine devices. And a study by Vargas et al. Found that women had concerns about the insertion and removal of the vaginal ring. They also had concerns about cleanliness and discomfort with touching the vagina were also some concerns that women had. And a venous thrombolism has also been associated with the use of the pill. A study by Voelker found that there is a sevenfold increase in women who are diagnosed with venous thrombolism that is caused by the use of the newer progestins. And venous thrombolism is a blood clot that forms in a deep vein. So, birth control, hormonal contraceptives can also be a means of health promotion. There's contraceptive counseling that's available, and it also allows women to control the timing of childbearing. It also ensures that women are healthy prior to conception. So, this allows for proper family planning as well, and it minimizes the risk of childbirth and pregnancy complications. And the public health impact, as I just said, it impacts family planning, which can definitely be a benefit, allowing families to properly plan before conceiving a child. And universal access to reproductive health care services. And the world's total fertility rate has decreased from 5 children per woman back in the 1950s to 2.6 children per woman in 2011. And this is due to the use of hormonal contraceptives as well as some other factors as well. And here is the reproductive impacts in Africa. So in Africa, there's a higher risk for developing HIV. And Africa is a resource-poor setting for hormonal contraceptives as well as other healthcare resources. And it's been found that women who use hormonal contraceptives in Africa are at a higher risk for developing HIV, which is human immunodeficiency virus. And based on the data that I have included in my next slide, which I'll show you right now, you can see that among sub-Saharan African countries, South Africa, here listed at the top, actually has the highest HIV prevalence of 3.1% among females that are 15 to 24 years of age when compared to the rest of these countries here in Africa. And so you can see that the percentage here for women is much higher than it is here for males, which is, and their highest HIV prevalence is only 7.1, and that's in Swaziland. And the lowest HIV prevalence rate, the lowest HIV prevalence percentage is in Rwanda, having a 1.2 percentage among women, and also in Congo. and men have the lowest percentage rate. Sorry, why do I keep saying rate? They have the lowest percentage of prevalence in Congo. And so here you can also see that HIV prevalent that mother to child transmission of HIV can be reduced by the use of antiretroviral medicines. That there's mother to child transmission of HIV is reduced by the use of these ARVs. And no vertical transmission was actually found in women who received more than 8 weeks of the antiretroviral medicines, and the rate of HIV transmission is higher in is higher than reported in higher income countries. So I'm going to continue speaking about the reproductive health impact in Africa. So in sub-Saharan Africa, the main mode of HIV transmission is heterosexual sex, and also there's an epidemic in children through vertical transmission, which is the transmission from mother to child. In 2013, an estimated 35 million people were living with HIV worldwide. And in sub-Saharan Africa is only home to 12% of the global population, but yet accounts for 71% of the global burden of HIV infection. And in sub-Saharan Africa, the main mode of HIV transmission is through heterosexual sex. Through heterosexual sex, and it's epidemic in children through the vertical transmission, as I just stated. And as such, women are disproportionately affected, which accounts for 58% of the total number of people living with HIV. And Africa also has the highest number of children who are living with HIV and the highest number of AIDS-related deaths as well. And mother to child transmission accounts for most pediatric HIV infections. And pregnant women with untreated HIV infection have a vertical transmission rate of 15 to 40%. And that's prior to breastfeeding. So transpatient transmission can also occur in pregnancy, but that is very rare. And in most cases, the virus is transmitted around the time of birth. And it's also been estimated that 20% of transmissions tend to occur before 36 weeks, and 50% in the days before delivery, and 30% intrapartum. Transmission rates for breastfeeding can be as high as 30 to 40%. And so here are some controversies that are related to, actually, I want to go back here for a second, continue to talk about the reproductive health in Africa. So vertical transmission is actually more common in preterm births and with prolonged membrane rupture. And perinatal HIV transmission is correlated with maternal plasma HIV RNA burden. And neonatal infection ranges from about 1% in women with less than 400 copies per milliliter in their blood, and to more than 30% when viral RNA exceeds 100,000 copies per milliliter in their blood. Therefore, proper therapy for HIV in pregnancy is very crucial to prevent vertical transmission. Okay, and so back to the controversies. So, about 20% of breast cancer, there's about a 20% increase due to the use of hormonal contraceptives to increase the risk of developing breast cancer. And cervical cancer is also an increased risk for women who have used birth control for more than 5 years. And it also can cause an increased HIV incidence as well. So, and as you all probably know, policy is also very key here, especially in regards to public health in general, and especially when talking about reproductive health as well. So, there are policies in place that affect the reproductive health of women globally. And one policy that I want to highlight here is the Mexico policy, which I actually did not learn about until I took my reproductive health epidemiology class. And I found this policy to be very interesting because it's very, very impactful, which I'll explain in just a moment. So the Mexico policy is actually now called the Protecting Life in Global Health Assistance Policy as of January 23rd in 2017, when President Donald Trump issued a presidential memorandum on this policy, which means that he reenacted this policy essentially. The policy now extends the Mexico policy to global health assistance furnished by all departments or agencies. So the Mexico City policy eliminates federal funding for coercive abortion or involuntary sterilization. And this policy now ensures that foreign non-governmental agencies that receive U.S. global health assistance do not even use even non-U.S. funds to provide abortion services, counsel patients about their options of abortion, or refer them for an abortion. And they're also not allowed to advocate for the liberalization of abortion laws. So this policy is nicknamed as the gag order because of the limitations that it puts on how organizations use their own non-US government funds, which prevents them from encouraging change. And Africa is one of the countries that heavily relies on US health funds to battle high maternal mortality rates and the HIV/AIDS epidemic, which I discussed a little bit earlier in this presentation. And so Trump's policy makes funds unavailable to the largest and most well-established providers of reproductive health services. This policy withdraws all federal funding in the or if the organization does not certify that they will provide reproductive health services, and therefore this greatly hinders the financial structure of the organizations and their ability to provide services to the people who need them. And this policy also includes interfering with funding to the Global Fund to fight AIDS, tuberculosis, and malaria. And these changes will cause a rise in maternal mortality rates, HIV/AIDS, and other diseases that organizations have been working very hard to decrease globally. And although funding from these programs have not been cut or reduced as they were in the previous policy when it was called the Mexico City policy, the impact here is actually much greater. So the impact is much greater because many countries need the assistance of these organizations to conduct other necessary public health practices, such as providing vaccinations to the communities that are in need. And here I have provided the copies of some of the peer-reviewed articles that I included here in my presentation. And these are my references here. And just to conclude, hormonal contraceptives are they work to efficiently reduce pregnancy, and it is best to consult with a doctor to determine which form of birth control is best for each woman. It has been found that hormonal contraceptives can lead to an increased risk of developing HIV, although it has many protective factors as well. There are policies in place that further inhibit the access to health services that are available in resource poor settings such as Africa. And there is definitely a need to increase access for reproductive health services in developed and developing countries. And thank you for watching my presentation. And please let me know if you have any questions. And I hope that you enjoyed all of the information that I provided.